So continue our topics on anti-rheumatoid drugs. Today we will be talking about the drugs which are used in chronic gout. So before we will discuss the drugs, first we will talk about what is chronic gout. What happens in chronic gout? There is, after the acute attack is over, there remains the persistent hyperuricemia, and that leads to the persistent pain and stiffness in the joint. And this persistent hyperuricemia then started depositing on the various tissues of the body that form various tophi on the skin. The sites of tophi include your joint. In the joint, there are formation of tophi around the pinna, there are formed the tophi around the eyelid, around the nose. Even in the skin, there is deposition of lot of urate crystal that forms the tophi. Also, because of the increased production of the uric acid and decreased excretion of the uric acid, there leads to the formation of urate stones in the kidney. So these all manifestations seen in the chronic gout, and because of the persistent hyperuricemia, persistent tophi formation and urate stone formation, this leads to the progressive disability and deformities at the joint in patient of chronic gout. So this is about chronic gout, and now we will be talking about the drugs that are used in chronic gout. So the drugs which are used in chronic gout, they are divided as the drugs which excrete the uric acid in the urine. That drugs are called uricosuric drugs, and there are certain drugs which inhibit the synthesis of uric acids, and that these are uric acid synthesis inhibitor drugs. The drugs which excrete the uric acid in the urine, these include your probenecid, sulfenpyrazone, benzbromarone. The benzbromarone is not used nowadays because of the potential hepatotoxicity of this drug. It is now withdrawn. Probenecid and sulfenpyrazone are used. Uric acid synthesis inhibitor include your allopurinol and febuxostat. Now first talk about the drug probenecid. This is a uricosuric drug, as we talked about. This is probenecid. It is highly lipid soluble drug, and it was initially used to prolong the action of penicillin. To prolong the duration of action of penicillin, it was used in 1951. What this drug does? This drug basically, whatever the drug being excessively reabsorbed, it tries to excrete that drug through the kidney, and whatever the drug which is excessively excreted through the kidney, this drug tries to reabsorb that drug. For example, penicillin is most of the time is excreted by the kidney, so the probenecid try to reabsorb this drug. Similarly, uric acid, when is more reabsorbed by the kidney, probenecid try to excrete it in the urine. So how does this probenecid do this action? It is basically stimulate one transporter known as the URAT1 transporter in the renal tubules, and by stimulating this transporter, it increases the excretion of uric acid in the urine, and thus acting as uricosuric drug. So about the probenecid acid, it does not have any analgesic effect and anti-inflammatory action. It doesn't have any anti-inflammatory action and not analgesic action of probenecid. About the drug interaction, it has few interactions with many drugs. For example, it decreases the excretion of certain drugs. These drugs are scheme drugs, just to remember scheme. These include your sulfonamides, cephalosporins, endomethacin, and methotrexate. So when giving these drugs with probenecid, their levels increases in the body. So we have to very cautiously while giving sulfonamides, cephalosporin, endomethacin, methotrexate with the probenecid. It also decreases the excretion of certain anti-tubercle drugs in the bile. These drugs are rifampicin, pyrazinamide, and ethambutol. So whenever you are giving these anti-tubercle drugs with probenecid, their levels increases in the body and toxicity can occur. So you have to be cautiously use these drugs. It also decreases the nitrofurantoin level in the urine, and thus not able to maintain the level of nitrofurantoin in the urine, and nitrofurantoin unable to perform its function in urinary tract infections. About the cell cyclates basically inhibit the action, uricosuric action of probenecid. So you have to be used cautiously with salicylate. About the pharmacokinetics of probenecid, it is 100% orally absorbed. It is 100% orally absorbed, and after absorption, it goes into the circulation where it is 90% bound to the plasma protein. It is 90% bound, and then it is conjugated by the liver and excreted by the kidney. About the half-life of probenecid is about 6 to 8 hours. About the adverse effects with probenecid, generally this drug is very well tolerated. However, the most common side effect noted is dyspepsia. You have to use it cautiously with peptic ulcer disease patients. Rash and hypersensitivity reactions are very rarely seen with this drug. At toxic doses, probenecid can cause convulsions and respiratory failure. About the use, as we know, it is used in chronic gout. Probenecid is used in chronic gout as a second line or as an adjuvant to allopurinol. It is used as second line or adjuvant to allopurinol. Usually it is started at a dose of 0.25 mg/BD, then this dose is gradually increased to 0.5 mg/BD. When used, probenecid decreases the blood urate levels, reduces the arthritis and tophi formation in chronic gout. Colchicine and NSAID has to be given with probenecid acid for the initial 1 to 2 months to avoid precipitate the attack of acute gout. So first we have to give the colchicine and NSAID cover for 1 to 2 months while giving probenecid. Probenecid and other uricosuric drugs are usually not effective in renal insufficiency when the creatinine levels is more than 2 mg per deciliter. So we have to keep this in mind. Also, because this probenecid causes the uric acid excretion in the kidney, that leads to the formation of urate stones. So we have to give plenty of fluid when giving the probenecid. So we have to give plenty of fluid to the patient while using probenecid to avoid the urate crystallization in the urinary tract. Also, as we know, it prolongs the duration of action of penicillin and ampicillin, and this action is required when using this penicillin and ampicillin in conditions like gonorrhea and subacute bacterial endocarditis. Also, when we have to we combine probenecid with cidofovir when we are using it for cytomegalovirus retinitis in AIDS patient to prevent the toxicity of cidofovir, because cidofovir can cause nephrotoxicity. So we have to combine it with probenecid. Another uricosuric drug is sulfenpyrazone. Sulfenpyrazone is basically the uricosuric drug, and it has pyrazolone derivative, and it is related to phenylbutazone. Similar to probenecid, it has no analgesic or anti-inflammatory action. It basically inhibits the tubular reabsorption of uric acid. So uric acid is not reabsorbed and is excreted through urine in the kidney. So with smaller doses, it actually reduces the ureate's excretion similar to probenecid. So we have to increase the dose to increase the ureate's excretion through the kidney. It has equally efficacious to probenecid, but it is gone into disuse because of the potential gastric toxicity and other side effects of sulfenperazone. It is withdrawn in the United States of America, and another action, it inhibits the platelet aggregation also. So these drugs are uricosuric drugs.